Experts are calling on South Africa to urgently tackle its health challenges. They're trying to create awareness around health issues that strain already bottlenecked healthcare systems. Now, they're saying that these are in most cases preventable. So what are these health challenges? And to discuss this, we're joined by Dr. Inna Eiberger from the P&G Health this morning. Thank you very much for making the time. And I think one of the big things that we're discussing around here is peripheral neuropathy. And maybe if you could just explain to us what that is and why it's so important for us to be shedding some light on it.
Thank you very much. First of all, I want to thank you for your interest in nerves, right? And when I explain what is peripheral neuropathy, I would start by explaining what are nerves. When we talk about nerves, you know, people think about nerve, brain, nerve diseases, mental health. However, nerves are everywhere in our body and they connect us to the world. Nerves control our digestion, heartbeat, moving my hand, grabbing a cup of coffee. I need nerves for everything. And these peripheral nerves that you have in your body outside of the brain are very important for your health. As I said, they are connecting us to the world. You can sense something, you can touch something, but you can also move your hands and feet. Peripheral neuropathy can happen to different reasons. One of the main reasons is diabetes. And when peripheral nerves are damaged, people will develop, first of all, it starts with light tingling and numbness in hands and feet, and then burning, and at the end, severe neuropathic pain, which can be very disabling. You know, and I mentioned that one of the most common causes is diabetes. Imagine the prevalence of diabetes in South Africa is 10.8% today, and diabetes is growing. Means in South Africa, 4.2 million of the adult population has diabetes, and 50% of them at least will develop nerve damage and peripheral neuropathy.
Yeah.
Many people don't know about it, and that's why it is very important to talk about this topic.
Yeah, no, absolutely. And if you're giving us the stats that you've just shared now around diabetes and how it's growing within the South African context, it becomes difficult to think about ways in which we can prevent this neuropathy. Are there any ways to prevent it, or just to be vigilant when your body starts to do things that are not necessarily normal?
Absolutely. You know, prevention, one type of prevention is also early diagnosis. People need to be aware, and doctors need to be aware and regularly check on nerve health. Whether a patient is losing sensation, for example, or proactively ask, do you have tingling, numbness? How about in the evening? Do you have burning in your feet? Or very simple, ask, when you're buttoning your shirt, does it become difficult? Because buttons are small and people cannot grab these buttons properly. Because one of the big issues is patients cannot verbalize the symptoms. That's why doctors need to be proactive and ask very simple questions to diagnose. And this is how we can prevent, because this disease, if you diagnose early, it is easier to manage. If you diagnose late, it's very, very difficult to manage.
Is it not a challenge, though, Doc, in that our health system in South Africa, particularly public health systems, are heavily constrained? And so you'll find that many doctors, only because of the amount of patients that they're handling at a time, won't be giving the necessary support to a person that might be afraid that they might have this condition. So how do we then create a space for partnerships to making sure that doctors are as proactive as they can be to help people get diagnosed should they need to, and then, of course, get the assistance?
Yeah, and you mentioned a very important point. You know, doctors do not have time. They manage 50 to 60 patients in their day, which is very exhausting. And what we do, P&G Health, you know, we do partner with doctors and experts and help them to simplify the diagnosis. How can they do it in 2 minutes? You know, ask simple questions. Our team in South Africa, for example, is sponsoring a lot of education events for healthcare professionals exactly on that topic, how to diagnose in an easy way in a short time. For example, last weekend, the South African medical team sponsored an education event on the diagnosis of neuropathy and B vitamin deficiency. And that education event was CPD accredited, means doctors get points that they require. And, you know, that's how we support, with support of experts and key opinion leaders, the doctors to manage the diagnosis of neuropathy.
Yeah. No, thank you very much, Dr. Inna Eiberger from P&G Health, joining us to speak about that condition there.